I'm Dr. Shalini Malhotra, a hair transplant surgeon practicing in Dwarka at New Delhi. Our technique of hair transplant is one of the latest techniques in the field of hair restoration surgery. Today I will be talking about the pre-operative instructions and the post-operative instructions you need to follow if you opt for surgery at our clinic. They are pretty simple. A patient after getting hair transplant at our clinic is able to resume his normal routine activities from the very next day. The pre-operative instructions are: stop smoking and drinking about 2 days before the procedure and 3 days after procedure. Avoid applying any kind of medicine like minoxidil or any other oil or lotion on the scalp at least 7 days before surgery. Stop aspirin or any other blood thinners you are taking about 7 days before surgery. On the day of surgery, take proper head wash. On a night before surgery, take proper sleep. On the day of surgery, have proper breakfast, wear a buttoned up t-shirt and come to our clinic. Avoid tea and coffee on the day of surgery. There are certain blood tests you need to get done before surgery, and these blood tests and the reports of these blood tests need to be furnished to me at least a day prior to the date of surgery. Apart from this, no major instructions need to be followed. And yes, if you have white hairs, you need to dye your white hairs a night prior to surgery. Now coming to the post-operative instructions. When your hair transplant is over, we will be applying a bandage at your donor area. Donor area is the back of your head. So a bandage will be there on the back of your head. The front will be left open as it is. You will go home with the bandage at the back. This bandage stays on your scalp for 2 days. On the 3rd day, you have to come to my clinic. We will remove the bandage from your scalp, and then you can go out and resume and meet people as you used to earlier. And if you want to hide your scalp and you don't want to show people that you've undergone a hair transplant surgery, you can even wear a cap. Full healing after a hair transplant surgery takes about a week. Certain instructions you need to follow after surgery. First is avoid gymming. So avoid going to gym or doing any heavy exercises or lifting of any heavy weights for at least 2 weeks after surgery. Avoid sun exposure for a long period of time. So for example, you have to go out in the sun for about an hour or more. It's always a good practice to wear cap. We will be giving you normal saline spray, which you have to spray on the implanted area for 2 days post-procedure. On the 3rd day, you can stop spraying this. Apart from this, you have to avoid swimming for 2 weeks after surgery. No yoga for 2 weeks after surgery. Once 2 weeks are over, there are no further precautions you need to take, and you can enjoy your life and you can live your life fully and forget about the hair transplant. Your results will take about 7 to 9 months to show. The cycle of growth of grafts is as follows. In the initial 2 months, you will start seeing hair growth. So your hair will grow to about 2 centimeter size. Once they grow for about 1 to 2 months, they will fall. This is known as the shedding phase. After that, fresh follicles will start growing from the 3rd month, and then the growth will increase in length as well as the density for the following months, and you will get your full results by the 7th to the 9th. Thank you.